Welcome once again to Church Alive, and this is your host and president of Church Alive Development Corporation, and also the proud pastor of Church Alive Community Church. And once again, we're here to bring you a holistic approach to the gospel. That is to bring you information, resources, and services that will improve the lifestyle of our friends, our neighbors, and certainly our loved ones. Well, thanks to AllMed, we have put together Ask Dr. Tommy O. And you're going to hear more about that as we go along. But we have put together a series of medical programs starting from this month, January, all the way through until December. And we're going to deal with different issues, different sicknesses that affect our community, you and I as well, and our family members. But we're going to give you insight that will help you to make the right decisions and certainly to get the right treatment, thanks to AllMed. At this time, we're going to welcome Dr. Tommy O.
Great, thank you. How are you today?
Officially, Dr. Thomas O'Brien from AllMed. We want to thank you very much for helping, really, for putting this all together, because this is going to be something very enlightening for our viewing audience. Okay, folks, we're going to go right to the listing, and we're going to go down and show you each month what we're going to be bringing to you on Ask Dr. Tommy O, presented by AllMed Medical Centers. As we look at our list, number one, today we're going to be talking about the role of the family practitioner. That's right, the role of the family practitioner. And then in February, we're going to be talking about asthma. Dr. Tommy O, tell us about asthma. Is it a real problem in the Bronx, and are you getting individuals who are coming in complaining about asthma, either children or adults?
Yes, it's a significant problem with in our metropolitan area, specifically Manhattan and the Bronx, where it's ranked #1 in the country for asthma, or acute exacerbation of asthma.
All right, so folks, in February, and we want you to know it's the last Saturday, and each month on Channel 70, we'll be bringing you Ask Dr. Tommy O, presented by AllMed. And so that's going to, and that program's going to come on at 9 p.m. on Channel 70 the last Saturday in every month. So in February, it's going to be asthma. And then in March, it's going to be lower back pain. Many people suffer from lower back pain, and they don't know where it came from, what they did wrong, but we're going to deal with it. We're also going to deal in April, we're having HIV, AIDS, and coronary artery disease. We're going to deal with both of those factors because on April, we'll be having a spectacular gospel concert of HIV awareness in the church, and we're going to have something tremendous at Church Alive. So, folks, we want to put a big circle around April the 24th and look forward to being there. And throughout the entire day, thanks to AllMed, we're going to have examinations for sugar diabetes and for high blood pressure and many others. And also Dr. Tommy O, you'll be able to meet him in person if you not have already gone to the clinic, and he'll be able to just connect with you in a special way. May is sugar diabetes, and that's a serious problem. Dr. Tommy O, when I first came to AllMed Center, there was a lady there, and I sat right next to her, one of your patients, and she was raving about you because she had a sugar problem. And just tell us a little bit about how she's doing and how things, and is that a real problem coming into the clinic?
Yes, diabetes is a significant pathology as well. I've been taking a poll, or where I'm looking at the hemoglobin A1C. This is something that we discussed about on a previous show, and I've been jotting down and keeping a log and seeing how low I can get the hemoglobin A1Cs, and my hemoglobin A1Cs have been dropping down in a 6 range, and this is where we're looking forward to keeping that as low as possible. So I'm making what we say a dent in the diabetes.
Okay, now we're going to go back to the list, and so that you can know what's coming up in the other months. That was April that we showed you, then May, Then also in June, eating disorders, and you're going to get onto that. And then we're coming up to July and August. Those months, we're going to look at those areas in just a moment. And we're all the way straight through until December. There we have July, and that is called, you can give us the, I don't want to mess up that word, so I'll give it to you, Dr. Tommy O.
Which one?
That's fibroma.
Okay, fibromyalgia and chronic fatigue syndrome.
Right, exactly. And we'll be going into that. Tell us, what is that really?
Fibromyalgia is what we consider pain of the muscles.
It's pain of the muscles.
Yeah, generalized achiness, and there's specific criteria that defines that, where we have tender points. There must be 11 tender points that are symmetric throughout the body, and we have a log of 18 that are designated throughout the body.
Right.
We must have at least 11 out of the 18.
Okay. Some people call that arthritis, I guess, huh? Well, joint pains and whatnot. They're not sure what it is, and that's important reason why they should go to AllMed, go to their practitioner, and get a good practitioner. We're going to move right along now and talk about, yes, we're going to talk about January. The role of the practitioner is January's topic, and Dr. Tommy O, what is the role of the family practitioner?
Okay, the role of the family practitioner is a physician who would be a patient's advocate, someone who is the caregiver, someone who oversees the patient's health over a lifetime.
Right. Now, I guess the question we want to then reverse and say, who is a family practitioner?
A family practitioner is a medical specialist who specializes in family care. It is someone who attended 4 years of college, then applied and was accepted into an accredited medical school, graduated from medical school, then passed a 3-part national board examination, then was accepted into a family practice accredited residency. This residency would be either accredited from the American Medical Association or the American Osteopathic Association, or both if it was a combined program.
Right. Now, when I open up my medical book, my insurance medical book, I have a listing of all the doctors and their specialty and whatnot. And in there, it has board certified, and then there's another word, board eligible. What does that mean? Because it's important in selecting the proper family practitioner.
Okay. I'll just start off with defining both of them. When you receive your catalog from your insurance carrier or a physician provider catalog, you'll see an asterisk or some sort of indication, or and that with a key on the bottom will say either board eligible or board certified. What that means is a physician graduated from an accredited family practice residency. If they sat for the examination, which is a national board examination, then they are what we consider board certified. If they have not sat for that extra exam, they are considered board eligible.
Well,
that is the primary difference, whether they took the exam or not.
Oh, they didn't. How important is that?
How important? It just gives you that added credentials